Welcome to Pacer Nursing Power Hour, your go-to spot for real talk and real tips in the world of nursing.
So plug in, scrub up, and let's go. This is Pacer Nursing Power Hour, where nursing students get powered up. Cha. Okay, so I've been hearing through the grapevine that the singing
That's key.
everyone loves.
It's key.
I
I
don't know
understand.
why. I feel like dogs are barking.
I enjoy
They're
it.
like, "Roar, what is that
And it
noise?"
all happened because of a whim, too. We were just
Jeremiah
trucking
was in
around.
here, and we were
Yeah.
so excited because we sounded normal.
It
You
just
remember?
came. Yeah, it came so
I
naturally.
know.
You did
We're the
amazing. And now
best.
it's stuck. Good.
So things have been really well. I'm really kind of happy with the reception of the podcast. We really gotten identified.
I love it. I love it. Thank you, Chancellor Heimerman, for your shout out earlier in the semester. Thank you, students.
Yeah,
Thank you,
for
direct
real.
admission students. Thank
For
you,
real. That was an
parents.
excellent thing during that direct admission open house.
Yeah.
Okay, let's get into it today. Let's rock it because I actually just talked about this in my class the
I
other day, so it was pretty
know.
cool, and we talk about this all the time just, like, casually because
And it's a big deal.
it's kind of like it's part of our life, it's a normal part of our life.
Yeah. So today we're talking about auditory overload. It is very common in the field of nursing. If you don't know what it is, we're here to explain it to you, tell you why it's bad, and then give you some interventions of ways that we as nurses need to fight back against it and do better. So, yeah, tell me about your U101 class. Tell me about the assignment that you did
Okay, so I did this
addressing.
really cool, assignment. It was about communication,
Mhm.
and, they're first-year freshmen, they haven't even started any kind of nursing courses, but they're all kind of cohorted together, and so the topic was communication, and I was trying to relay it not just to their studies currently, communication with professors, with each other, but like for the rest of their life. So let's start with good patterns now. So we started talking about clarifying using clear, concise, effective communication. But then I also threw in some noise because you and I can have this conversation and it's very quiet.
Mhm.
But like I've often said, there's 55 voices also in my head as well. But then if we open the door and classes are changing, there is constant noise.
Constant.
And I'm a squirrel. I cannot finish a sentence if I get distracted. So
You're cute and
there's
tiny, though.
two things. Do not even do that.
You
Okay,
are, though.
don't tell me I have a fluffy tail either, because.
You don't.
But I get distracted by noises around me because it can just be so overwhelming.
I totally feel that. I even feel that at home when my husband and I are trying to have a conversation, and then there's the washer going off. It's alarming that it's done, and then my kids are asking me a question. There's just so many distractors. Well, I have a question for you.
Okay.
Think back to when you were doing bedside nursing, like 2 years ago, and what do you remember being the loudest distractor on a unit?
Um okay, for our unit, we have a doorbell because it was a pediatric unit and
A locked
it's
unit.
a locked unit
I remember that.
and the clerk was never sitting there and it's the loudest no it's louder than the
Really?
intercom.
Holy
So
moly.
it's all through the like entire floor, bathrooms, and it's like ding ding. I mean, and it's like constant. And then if you don't answer it or push the button within 2 seconds,
Ding,
their
ding, ding, ding,
people
ding,
are
ding,
out
ding,
there
ding, ding. Yeah.
just sitting on it.
Yeah.
That is the most annoying because it's a it's like a Pavlov's dog for me. I
Uh-huh.
get stressed out because open the door. These people need to get in to see their family, but we need to make sure they're legit. They're supposed to be,
Yeah.
especially during COVID and flu season, because we limit visitors with flu season.
That's similar to L&D. where I worked, we used a system called Feedalink, and it would constantly, I mean, if there's any change, like if the fetal heart strip dips, it's ding, 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 ding.
Oh,
And you
I
talk
remember
about,
that song, but that's a pretty ding, though.
but it's so regular because the more patients you have, the more frequent it's going off, and then you have the doorbells and stuff. But what's funny you mentioned is Pavlov's dogs. When I started my first F&P job, there was not another provider, but another employee in the office that did something else, and his computer had the exact same sound. And instinctively,
But
I don't
for,
know
like,
why. For something
receiving
else, he
messages
wasn't
or
even medical. He wasn't even medical. I guess it was like an email alert or something.
did
In
you
his
just pick it
office,
up and throw it outside?
I
Because
told him,
I probably would have done
I
that.
was rude. I was rude. I was like, I need you to turn your volume down. And he's like, why? I'm like, every time you get an email, I just instinctively feel like I need to get up and
Okay,
do something.
let's just talk about this. Please, for the love of all people's sense of, well-being, turn off your ring
I
volumes.
do. I don't. That's probably because of my nursing career. I never thought about that, but it's probably, I always have my phone on silent. Always.
Yes, and text. Well, I mean, I'm so, like, I don't wanna be that person in the audience that phone goes off and, the whole show stops and talks bad about you, but still, you remember the old phones that the ring used to be, "Dun na 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 na," or
Yeah.
something like that, like, in the middle of this massive conversation, "Turn off your phones."
Yeah. Don't be that person.
But yeah, also, when I worked in the ER, all kind of sounds other than
Mm hmm.
patients yelling is really a big one because
Mm.
that's really kind of discerning as well. But, I remember biomed kinda coming through to test our alarms,
Oh, yeah.
and we'll get into this later, but he would get so angry with us because we would just keep going and doing what we're doing when he was testing, because 'cause we're like, "We're done." Okay. Yes, 'cause so, um what is other than that, what do you think? What would be the worst other than but that's a pretty alarm for your labor and your maternal things. What's the one that would wake you up and go, "Oh my gosh, we need to go"? I think I know the answer. I think I know the one that would get you out of your seat, like the alarm or the noise that would get a labor and delivery nurse out of their seat. What would that be?
Someone yelling that they're delivering their baby? I don't know what you're saying. I don't know what your
I
answer is.
would
Perfect.
I was thinking crossing that threshold with the armbands on.
Uh,
What's that security system called? And it's like the
yeah, it has
worst
tags.
noise on the planet.
Yeah, I probably should react, but in my unit, there was a room right next to it, and we always like
Okay, so
we're
y'all got
trained for it.
desensitized to it.
Yeah, I mean that's part of the problem.
But
Yeah.
see, the rest of us on the outside of those doors, we hear that noise and then we hear that code pink.
Mm-hmm.
We're all running to the door. It's like Pavlov's. Like we are so well trained, and we don't get enough props for that
Sure don't. Sure don't.
at all. At
Sure don't.
all. All right.
Scroll me.
Okay. So let's talk about what is okay. So we say the term auditory
Mm-hmm.
overload. Not a lot of people, if you're not in the medical field or around us at any point in your life, what does auditory overload mean?
Yeah, so auditory overload is pretty much exactly what it sounds like. It is too many auditory triggers going on that prevents you from performing at a high caliber. So, we've mentioned several things like call bells, doorbells, commotion going on in another room,
IV
IV
pumps,
pumps,
bed
feeding computer
alarms.
systems,
Oh yeah.
overhead alerts. I mean, even like in
Oh,
L&D.
and let's not forget the good old phone ring.
Oh yeah, the phone.
Woo!
And then the patient can't
God.
reach the phone. I mean, all these things. But even like in labor and delivery, we play a lullaby, which actually has a purpose that people don't appreciate. But even stuff like that is a it stops you for a second from doing what you're doing. Even
No,
conversation.
I remember I don't remember the facility that I worked in the last I don't remember that, but I do know across the street, I would hear it and I
Hmm.
would just go, "Aw,
Yeah,
that's a little joy for my day regardless." Because we talk about how when we're at work, sometimes often it's people's worst days, well,
and that's a little bit of
that's a
happy.
little bit of cheer.
Yeah.
Yeah.
But it does stop the
Nah,
conversation, whatever. If
for
you
2
are doing
seconds and then
yeah, you were
you
doing
keep going.
discharge education, then that's a pause and you have to maybe reorient to where you were. So it is. It's a problem. Even conversations at a nurse's station, like I've been on units where the Pyxis is kind of right next to the nurse's station, and they could be having a conversation while you're pulling
Oh,
meds,
y'all don't have a
and
closed
that
room for
can
your
be.
med room?
Mm-mm. So
Oh,
yeah, there's a lot of things we can do to battle auditory overload,
we're gonna talk
but
about that later.
a big
Yeah,
problem.
it's still a big problem because, it's important. Sometimes we are the ultimate multitasker.
Mm-hmm.
We are.
Well,
Nurses
yeah,
are.
we're expected to be.
We have to do everything. We have to feed, you know, actually physically feed, go get supplies, do our nursing stuff, do our assessments, run ourselves ragged. But in the middle of all that chaos, we've got to know what we're doing at all times.
Mm-hmm.
Um,
Yeah, high
and
stakes.
it's important that we don't get distracted when it comes to the really, really crucial elements of our job.
Yeah,
And not a lot of people can recognize that who don't do it every day.
yeah. So recommendations suggest that decibels stay below 35. And I find this comical
Yeah.
because I drive in my Jeep with the doors off
Uh-huh.
and I get alerted on my watch that my noise environment is too high and it's set at 90.
Okay, so I get my phone goes off at 55 decibels.
55? Nice.
Yes. And so that doesn't even register in the clinical setting.
It doesn't register it?
No.
So mine goes off all the time when I blow dry my hair, when like
Okay,
Daniel and
well,
the
you're
girls
apparently
are.
wearing yours all the time. But no, in clinicals I do, but it does not go off unless it's a code situation, but it doesn't go off.
Okay, so I'm going to experiment when I'm in clinical next and I'm going to set it lower to 35 and I'm going to count how many
Yeah,
times.
all right. All right, and we're going to challenge all of you guys out there, do the same and let us know what those decibels are.
So, question.
No.
I always throw the curveball.
You always
No, it's
really
just an
do.
opinion question. Do you think nurses over time learn how to phase the extra noise out and focus more? Or do you think they just like get used to the noise and just let it be?
That's a relative question because on one hand, yes, we've learned, and I'm going to give you a perfect example of
Ooh,
that.
okay.
When you're listening to a crying baby's lung sounds
Mhm.
or noise around you,
Mhm.
you can I have learned to tune everything else out except for what my ears are listening to with my stethoscope. And no, I do not have those fancy noise cancellation earbuds on my
You
stethoscope.
have some OG stethoscope.
Oh, gee, because I got into all the
Stolen.
expensive stuff stolen at one point. Like bought a Mac Daddy cardiac, and I was so proud of that thing. It walked off 2 weeks later. So no, ma'am. So I've learned to how to focus and hone in on that. However, on the other hand of that, abso-freaking-lutely. Again, like the biotech guy, he would purposely come in and everyone we know that would be on a monitor, especially in critical rooms, would be sitting pretty at like a normal sinus rhythm. He would purposely come in and put them on VTAC or VFib. Not a. I can honestly say 98% of the time we just kept doing what we're doing, and he would be like, "Hello," I'm like,
Yeah.
"You're doing it. We know. It's okay." Because what? And I'm going to tell you also, 9 times out of 10, if I heard noises like that, I'm looking at my patient. So if I'm looking at them and that noise doesn't, it's like when I had a student clinical one day running down the hall. I was at the nurse station, running down the hall, and I was standing in front of the monitors, and I can see baby's saturations go like to 85, 83, and the student's just like, listen, a flat out sprint. Professor Kennedy, Professor Kennedy, like sweat dribbling. He goes, hurry, I need you. Their sats are dropping. And I go in the room, and the baby's sitting up laughing. And so I said, okay, let's look, breathe, stop and breathe for a second. Look at your patient.
Match it up.
Where's the pulse ox probe? And it was flapping in the wind on the bed over here. I'm like,
Well, and that's one reason why it's concerning because we've therefore trained ourselves not to do
not to
anything,
listen.
not to do anything. And thankfully, in that situation, there was it was a
Okay.
malfunction
Mhm.
of the equipment. But when that happens over time, the times that we need it, we're like, meh, it's
Yeah.
just not on their foot right or
And
whatever.
another unit that really kinda it stressed me out was when I would, float to the few times I would float to NICU,
Mhm.
and, a lot of those babies with heart anomalies or certain conditions, their saturations they're gonna hang in the 80s, which, a normal oxygen level is an
Right.
A+. plus. We want you to have an A+, plus, 95 and above. 100's great. But these kids live at 85, but they don't change the settings on those monitors, so it is a constant alarm, but none of them are looking up.
Yeah,
So, how effective is that alarm then?
it's not. And that's the problem. That's where the problem lies.
Yeah, you just get used to the noise.
So, we're all about evidence based. And
Yeah,
I pulled some research and I was reading that the top units that suffer from auditory overload is ER ICU, which
of
I think we can
course.
all agree with,
Yep.
pediatric units, and L&D units.
Oh, yeah. I can
Those were the top four that I kept seeing over and over and over again.
Peas is kinda shocking for me.
Really? But you just gave a prime
Well,
example.
yeah, babies are crying all but I don't equate that to the level of what's happening. I would say pediatric ICU versus that's much more loud environment than med surg. But it can be again, but
Yeah.
still, I
But I
find
think
that
about like you have your patient who may or may not talk at that point.
yeah,
But then you have a mom, a dad, these
15 family
alarms. Yeah.
members.
So I mean that just
I
we're
do miss
start
COVID visitation rules.
you're not gonna lie. Oh my god. You're not. I cannot.
Yeah, that was yeah, so, that's shocking that peds is up there. Because I would almost have you ever been in a holding room at 6 o'clock in the morning when they're prepping 29 patients to go to the OR?
Mm-mm. No, I haven't.
That is sheer madness.
Yeah?
Sheer madness. Yes. You have and it's crazy. I've seen it. I've lived it. I mean, it is a lot of noise. People are yelling over each other. I need another 22 or 20, it is sheer madness.
Lots of overload.
So close your
Okay.
eye. All right, I'm gonna set
Oh,
no,
don't do
I'm doing it to
you.
you.
Okay.
All right.
But I already said my answer, so it's not very good.
Oh, the monitor?
Yeah, feed a link every time.
Okay. All right.
I'm still with my eyes closed.
Now stop thinking L&D. Be practitioner.
Practitioner's a
So
little
you so
different.
I'm gonna set the stage for you. So it's they
Okay, I'm closing my eyes.
instead of your urgent care for some reason had to stay open all night.
Mm-hmm.
Everybody's inundated. And so you're coming in at 7 a.m.,
Mm-hmm.
taking over,
Mm-hmm.
and it's kind of full. You're getting your call, you're getting settled. You open the door and you just kind of just breathe. What is the first noise you hear when you walk on a unit like that?
I'm gonna say vital signs machine.
Yep.
Like there's always
A sphygmo, like the
yeah,
blood pressure cuff going
yeah.
up or down.
And then out of a unit, there's always someone with something abnormal, whether it's like you said, it's your parameters that set, which can be
They
changed.
can be.
So, I mean, yeah, a COPD patient, their oxygen levels aren't going to be 100%.
Mhm.
And that's expected. That's an expected finding. And I ask them, what are your norms? And we change the monitor settings to set that to
As
go
it should be.
appropriately.
So,
But
let
yeah,
me
no,
ask
that's
you
perfect.
another question.
Hmm.
How many questions do you get asked as a provider
Oh,
in
yeah,
a
it's constant.
shift? Like, ballpark it for an hour.
100 at least.
I would lose my mind.
Yeah. But I mean, honestly, more than the questions is the chitter chatter. So the way that my urgent care is set up, our charting, the providers sit in the middle of the entire building. And it's one, like, I'll say table. And the MAs sit on the other side. Like our computers are facing each other.
Okay, gotcha.
And I mean, just like you and I on any unit, we'd be talking about Will, we'd be talking about Stella, we'd be talking about scooters,
Yeah,
all this stuff, all
Rachel and
the
I would talk
life
about
stuff.
goats. Yeah.
Yeah, all the life stuff. And here I am trying to make life decisions for people
Yeah.
while they're talking about their goat, and I'm like, "Oh my gosh." It like, ah.
So, that brings me back to the conversation I was having with my freshman student. So, in the middle of a code, you're in a true code. You have someone's doing compression, someone's
Mhm.
intubating, or getting that airway established, or either ambu bagging. You've got people pushing meds. You've got doctors calling out orders. You've got that closed loop. You're calling back and verifying you're hearing what you're hearing. That's a lot of noise.
It's a lot of noise.
Now, and I think I've discussed this previously. I remember the exact day, I can remember the exact code where the AHA kind of changed its guidelines to where during codes, we shoo families out of the room just because we didn't want them to see that because it's aggressive.
It is aggressive.
But they now it was like keep them
Keep
in,
them
and
in.
I remember, seeing that first patient that we didn't kick
Mhm.
out, and it was scary, so someone had to then come out of that madness
Getting goosebumps.
and talk that family member through it. It is so much
So on top of all of the noise, you have family that are experiencing trauma.
and your heart hurt.
And let's be honest, every nurse that experiences a code, that's traumatic. It
It
doesn't matter
is.
how many times you've done it, it's traumatic every single time. So you
Yes.
have your emotional well-being at play, you have all this auditory overload, you're trying to keep your critical thinking skills on point. I mean, it can be overwhelming very quickly.
Mhm.
So the things that we can get rid of, like the auditory overload, those things need to be resolved.
Mhm. Absolutely. When you were a new student, because you this is my question to you, because I can't answer this question because it's been too long.
Okay, yeah. Yeah, dementia.
What was the first sound that told you when you walked out on that floor with that RN on your name badge? What was the first thing that told you this is not nursing school anymore? This is real.
The first thing that jumps out is a woman that came into the ER. She had just arrived via EMS before shift change. We come out on the floor and she is screaming bloody murder. And I'm like, "What is going
Any
on?"
specific topic?
She no, she was having a baby and swore she wasn't pregnant.
Oh, I've had that same
Yeah.
patient,
And I was
but she
like,
was
but it
pregnant.
sounded, yeah, she was
Okay,
pregnant. It
mine was
sounded
the opposite.
like a mix between dying and out of it. Like it was ridiculous. But then pure chaos hit because the room's not set up. I mean, we're in the ER. As
The
you know,
baby's crowning.
ER nurses don't deliver babies.
No, no,
They
no,
don't.
we do not. We
Now
call labor and delivery
we can't.
and get fly on down these stairs right now, please.
There was no time for that. So yeah, I mean, baby was delivered right there in the ER bed. But I remember thinking, whoa, this is real
So
life.
was a baby crowning
Mhm.
coming out of the
Yeah, and the whole time, as she's actively delivering, she's
did,
saying she's not pregnant.
did EMS say baby's crowning or did
They asked, "Are you pregnant?" And she said,
they didn't
"No."
look? Oh yeah, she still has unclothes at that point.
Yeah.
They don't unclothe them.
Yeah, it was actually the charge nurse that was like,
Oh, that's good stuff. I
"Uh,
love it when that kind of happens when you're in
I
charge.
need a doctor." And that's when everyone was like, "Ah, baby bed. Oh, warm blankets. Oh."
Be
Like,
like, nope,
yeah, and it was just
no, thank you.
and it was first thing on the shift. It
I
was
do not like
madness.
precipitous deliveries. That's
Yeah.
what those are called.
So, Kennedy,
All right.
think back
Oh Lord. Oh yeah.
prehistoric times.
Oh, that's not even
I'm
nice.
just kidding. I love you.
Especially
But
since I
think
just
back.
had a birthday, man. I have to check a new box. Like I've moved
I
into a
can't
new
even
box.
tell you.
Yeah, but I'm still reeling from I've moved into a different box. I went from
That's okay.
50 to 55 to now 56 to 60.
You're rocking it though. That red light.
Oh my god, the red light
On
rocks
point.
and my scooter
And your
rocks.
scooter.
Okay. All right, so
So
back to
tell
my
me about early in your career. What were the sounds that were just shocking to you as a new grad that you didn't appreciate while you were in school?
um it wasn't the sound. I mean, it was the sound of the phone ringing, and then
Yeah.
my answering, "Hi, this is, uh, this is the nurse. How can I help you?"
Uh huh.
Saying that or answering a call bell,
Uh huh.
like that's when it kinda hit real, and then I was like, "Oh my god, what do they want? Do I know how to do
Do I
that?
know that?
What am I gonna do?
Do I know the
Help,
answer?
help, help, help."
Tap out, tap
Yeah.
out.
I I wanna go back home. What does Dorothy say when she clicks her heels?
There's no place like home.
Thank you.
There's no place like home. So in that moment, I think I know your answer, but is it overwhelming?
Oh my gosh,
I think
yeah.
even a seasoned nurse can agree or at least appreciate that it can be overwhelming. Some days are better than others.
And we've talked about, you remember, sometimes you for coping and stuff, you just need to take a step.
And you and I have mentioned like doing the stairs. Take 3 minutes, do a couple flight of stairs, come back, have someone watch your rooms while you're doing this, obviously. And sometimes you just need a breather to settle your brain cells and get back to business.
I will tell you, in the last department when it was like one of those days, and I just couldn't do the walking. It was too much, and it was just overloaded.
Yeah.
Um,
You were overloaded with the overload. Got it.
yeah, I found a corner
Hmm.
and I just sat there and just breathed.
Yeah.
I mean, I actually breathed. I did a little bit of meditation. Shocking. Don't be shocked, everyone. I know that's shocking. Everyone's mind's blowing. But I do my meditation in my own way.
Yeah. Yeah.
Oh, Lord
You're
gosh,
right.
jeez. Okay.
Actually, Stella was having a meltdown last night, and Sunny talked about triangle breathing, square breathing, and cookie breathing. And I was like,
Did she
okay.
learn this at school?
Uh huh. She learned it at school.
You're
Well, yeah.
paying for that education. All right, what is that? I need
So
to.
triangle breathing is 3 counts in, hold it for 3 counts, and then let it out for 3 counts. And then square is 4 counts in, hold it for 4, let it out, and then
Okay,
hold it.
first,
Cookie breathing is smell the cookie.
okay, see, that's better. I don't need an assignment to tell me how long to hold my breath. That's stressing me out even more because I'm like, am I keeping the 3-second time frame or did I exhale too
Did I
fast?
pass? Did
Yeah,
I hold it the right amount?
that
Oh
is
my god.
too stressful.
I'm gonna keep
It
you.
defeats the purpose of
Okay, so
breathing.
you get cookie
I mean,
breathing.
people, come on,
Like
y'all agree with me, right?
you,
Right? Come on,
you,
someone has to agree with me.
you and the 10-year-olds get the cookie breathing.
I'm doing cookie breathing.
Oh my gosh,
I
I
did,
can't
in fact,
handle you and your
whip.
generational thoughts.
Okay,
Moving
I'm done with
on
y'all.
past my cookie breathing.
Cookie. I can't do his voice. I wish I could do
Have
his voice.
you ever felt like you can't hear myself think?
Oh, yes, but, I'm gonna tell you where it
Oh no.
happens the most. At home. At home.
Yeah.
And I don't know why because I think, um, I feel like it's supposed to be my me environment,
Yeah.
and then I lose control of it.
Mhm. I feel that.
And, we've talked about, my thing that just, sets me off, kinda unevens my world is if my kitchen's dirty. What about you?
Um
Where do you find yourself most
I
often
mean most
saying,
recently is what we talked about like when I'm trying to chart, there's a lot of things as an FNP that I don't feel like I charted as heavy when I was an RN. And there's a lot of details. I mean, we've all heard of CYA. There's a lot of details that go into those notes. And when I'm trying to be unbiased and like think professionally, and then someone's talking about their goat right next to me, it's rather difficult. So that's when I get distracted, and that's frustrating to me because I'm on a time crunch. I mean,
"Yeah,
I
you gotta
signed a
get all that
contract
typed
saying
out."
I'm gonna see so many patients an hour,
You
and
do?
mhm, yeah,
You really have to. What if they don't show up?
that's different. I can't
Okay.
change that. But yeah, so I mean, and I have the like methodology of not going in another room until I've finalized the prior patient's room. So I go in, do my job, come out and chart, sign off my chart.
Wow.
I go in, I chart, I sign off my chart.
You are
Otherwise,
every
stuff
lawyer's
gets.
just dream.
I do appreciate that. I have two. My sister-in-law's a lawyer. My brother's a lawyer. I have heard all of their stories, so I do try really
But
hard.
it's gotta be a
I know it
cumbersome
was five
process now.
meds, and I'm only remembering four. What's the last one? You know.
That's gotta be a
Yeah, it's frustrating.
cumbersome process though now.
It's a lot of
I
responsibility.
mean, we've been talking a lot about interchangeability within EMR systems, and I know that that has gotten a little bit better as far as prescriptions go, like computers talking,
Yeah.
but it still seems like there's a lot of issues happening.
Yeah.
Okay.
Yeah.
So, uh,
So, what do you think are resolutions to this problem? So, we know auditory overload is a big deal in nursing. We know there's bad outcomes. It affects patient outcomes.
yeah,
It
why this
affects
matters.
it affects nurses, their capabilities, their mental health.
Patient safety. It impacts
Patients,
patient
yeah,
safety.
which is the root of all the things that we're doing, you
Yep.
know? So, what suggestions do you have for students that we have now and new grad students? How can they fight this battle and prevent auditory overload from impacting their career?
So, I mean, I really think we hit on a lot of those
Yeah.
topics when we talked about coping. I believe that was episode 5.
Mm-hmm.
Um, like using those mindfulness breaks. But I think what I started to do when I discovered my first, and I am that parent that calls them apple buds.
Oh my gosh.
Shut up. I do call them my apple buds. Be quiet, leave me alone.
I
The
don't see
noise
anything.
cancellation ones, that
Yeah.
was a game changer for me
But
because
not
there.
at work, right?
Oh, no, yeah, I did, and
Oh,
Imma tell you when I started. Because you
okay.
remember after the pandemic, I came back from Albany and I ran the garage,
Okay.
and, I would have to make phone calls and, remember, we would have 4 cars wide, 6 cars deep inside the garage with 20 people
Swabbing and going.
swabbing and going and, labeling and slamming the refrigerator, and they had music cranked up,
Mm-hmm.
exhaust motorcycles, everything. And so I would have to make a call going, I don't have this patient registered, but and I remember a friend of mine, Brittany, she said, try these. And I could hear the cancellation go on. I was like, I am never leaving home without these. In fact, they're in my pocket.
I
I
love it.
Because when I need to focus and I know I'm out somewhere, I'm gonna put those bad boys in because I do it at night too, and Claire is
Mm-hmm.
bathing Will because it is such a loud process.
Yeah. It's funny.
They're just yelling at each other. And so and that's when I'm trying to decompress because
Yeah.
I'm in overload
Mm-hmm.
and I'm in my own room and I'm just trying to decompress, but
Yeah.
I can't. So I put those suckers in and
I think it's a great idea.
I just tune them out. But for me to be able to tune out, if it's a particularly ridiculous day, I'm not above putting those suckers in.
Mm-hmm.
Yeah, so that's what I do.
I think learning to set parameters on and being confident enough to change the parameters on your monitors are super
That can
important.
get tricky though because there's a lot of policies that dictate you
There
can't.
are, there are. Yeah, that's true. Very true.
We have to be cautious.
I argue them though because if
Oh, well, I
you're
do
critical
too.
thinking and if it's appropriate, I mean, if we have a baby that's been running at 110 the entire stay, that moderate variability is every time
Yep.
it dips below
Yeah,
110,
and
it's
then
going to
you
be a problem.
and
We
we have
know we're going to deal with it for 12 hours straight.
and we
So,
have a teletech calling us, telling us our patients, okay, we know this.
yeah. So I
So
think
yeah,
that's
I
a
mean,
good.
I get that.
Okay, I have more good ideas. I had to remember them.
Okay.
Closing patient room doors.
Oh, well, yeah, that's for sure.
But these are things that new grads might not think about.
Yeah,
So, closing patient room
the
doors,
right one, so
designating quiet hours on your unit. Heller,
well, yeah,
I think that's important. I mean, for the patient well-being, there needs to be quiet hours.
and there used to be, like, I remember them turning the lights out at, like, 3 p.m.
I see it in like ICU units, but I don't really see it anywhere
Anywhere else,
else.
no.
Yeah.
Mm-mm.
We've talked about alarm volumes. Silencing non-actionable alarms, huge. Like
And
an email,
we talked about
turn your
this
email off.
on my phone,
Yeah, turn your phone on
my
silent.
alerts.
Well, and that's another I guess resolution to the problem could be more visual alerts like we do meows in women's health, but it's mews. I think the rest of the hospital
Pews and pediatrics.
pews and peds, those things just pop up and
Right.
you can't advance until you do something with it, you know?
Correct.
Things like that could be beneficial as opposed to the auditory. But then again, I'm sure we would lean more into a visual overload. So I think there's a fine balance. So I agree with you. But it might be a resolution to maybe dimming some of the noise.
Absolutely.
Yeah.
Um, and I tell every single nursing student, and you probably don't remember it. I
What
uh,
you trying to say?
I purposely tell every single nursing student that they have to make me a promise. One of them, I'm sure I make them do a lot, but I can't remember all of them. And one of them is being, if you are walking by a patient room and you hear an IV alarm going off, if it's not your patient, for the love of Pete, go in there and at least hit silent and go get the nurse.
Yes.
Or, better yet, if it's just a volume and you've got like a little bit left, add a little bit more and tell that nurse, hurry up and go get a bag and
Yeah.
refill.
Yeah, that was something that was really different from my ER experience to my L&D experience. The ER,
You don't use a lot of pumps unless you're on. We didn't. I don't remember. Again, it was I back in the day. I mean, for like emergence.
I'm so old. We didn't have electronic pumps.
I'm gonna smack you. That is not what I
What
said.
did you mean you didn't use
Okay,
pumps in the ER?
we did a lot of
You didn't
boluses.
hydrate. Okay,
We did a
I'll
lot of
accept that.
boluses, and
Still,
we just bypassed the pump, and we just opened up the clamp. Now, mind you, you did not let me finish, Jeff Kennedy. Um, you have to use it on a lot of things, antibiotics, vasopressors,
that's
all.
why I'm like, why would you not use a pump?
No, I'm counting the drops per minute. I'm that good.
Okay, okay, okay. So that was something that was really different from the ER to L&D. I felt like my experience, people might throw back at me, but in my experience in L&D, there was a lot of teamwork, and not to say there wasn't teamwork in the ER, but things like that. We would pop in each other's rooms, and we had the time to kind of know a little bit about our
Mhm.
neighbor's patient and what they needed, and
Yeah,
things like that versus being swamped.
in a chaotic
Yeah,
environment.
it
Mhm.
just felt more organized versus the chaos.
And yeah, Claire was talking about that where she did her preceptorship.
Mhm.
She did it in an open heart kind of recovery,
Interesting. Cool.
and she digging it,
Love it.
dug it because she's done with it.
Done.
But she said what was awesome for her to see because she grew up in working in an ER for the past 7 or 8 years.
Sure did.
Is that when a fresh heart came out, everyone except for one person would go help that
I
and
love it.
get that heart settled.
Yeah.
And that's what you want.
Yeah, you do.
You want
You want good staffing enough to do that.
Mhm.
You want that camaraderie. You want the success of each other. And in the ER, I felt like some days
You sink or swim on your
you
own.
don't have enough staff to really do that, and sometimes you're running a code with only a few people and all these things. But in L&D, if there was a stat C section, pretty much everybody dropped what they were doing,
Jumped on
and
board.
we're getting a baby out in 6 minutes. Yeah.
That's cool.
Yeah.
Yeah, that would be like, when the code STEMI would come in.
Yeah,
Like, the
exactly.
amount of
Okay,
people,
stop. Let's go. Knock
STEMI or
this out in
stroke.
3 minutes and
Yeah.
then be done.
Like, I remember our first, door to bed, like,
Yes.
8 minutes and 26 seconds. I still remember that. It was Doctor
Yeah.
Cundy too.
Love it.
Like, we had his whole, like, lower half shaved too. I mean, it was awesome
Yeah. Hands
when
in the
you
back.
have that kinda teamwork.
Yeah. It makes a
So,
difference.
yeah, it really does. Okay, so, um, let's go back. Things that you're never gonna see. So, we've already done our episode on Hollywood versus, real life or
Mhm.
hospital. But,
Yeah.
however, I don't think we ever touched on this. Um, have you ever seen in any medical drama
No.
3 pumps with a low battery? Not just beeping, just low battery, and then you plug them in, they still don't work. Like,
Yeah, no.
and you're switching pumps
That's
out.
never the climactic problem on
Never.
Hollywood.
Like, they're
Or
all just
yeah.
turning up the rate or whatever. I don't know. I've never s I if a physician I see actually knows how to work that pump, he has got my respect until the day I die. What about, bed alarms going off in, like, a
Oh, yeah, no.
melody
Never
kinda
saw it on Grey's Anatomy. Nope,
I mean,
nope.
those noises are, and I feel like they come up with the worst noises possible so we don't have alarm fatigue.
Yeah, absolutely.
So what is your most ridiculous noise story? Do you have one?
No.
I feel like
No, I don't.
the
Well, I think the story that I think of most when it comes to auditory overload is when I come home at night. I don't realize in the moment how stimulated I've been, and then I come home after that 12-hour shift of constant overload, and I'm still stimulated. I still feel
jacked
stimulated.
up.
Yeah. And then when my husband says blah blah blah, blah and then Sunny blah blah blah, I'm like, whoa, I need a minute. I actually really enjoyed working out in Wagner because it was a 30-minute
That's what
drive
I was about to say.
to and from.
So I have heard I used to hate having to drive 23 minutes
Mhm.
across the river. I learned to just cherish that time because it gave me that moment to decompress.
Yeah.
And many people say that drive home gives them solace.
Well, I have a stethoscope hot takes for you.
Ah,
Are you ready?
yeah. No. No.
Which sound do you prefer the least? Call bell going off or someone yelling code blue?
Oh, for the love, hands down, call bell.
If you could give one noise a makeover, what would it be?
Oh, it's got to be those bed alarms.
It sounds like it. What would you want them to sound like instead? Or how would you fix them?
I want them to sing to me happily.
Okay.
My patient's out of bed. Come help her. Help her, help her, help her. They would be funny though. It'd
It
make me
would be.
laugh.
It would
I
be.
need I need comedy. I need laughter. I mean, not because anything is not serious. Every moment is serious when you're at work. But I feel like if you bring joy and laughter, it just
Yeah.
makes everybody around you better.
Okay, think about your favorite unit you've ever worked on. You don't have to tell me what unit it is, but
Imagine.
what song would describe that unit?
Oh, I know exactly. It's the team. It wasn't the unit. It was the people. Um, uh, we, um, we are family. Yeah, na 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 na. I got all my sisters with me. Yeah, I mean, and they're sisters and brothers. But that would be it. That would be us because we literally not only took care of each other while we were at work, we still take care of each
Oh
other
man.
to this day.
Okay, last one. If you had to describe a 12-hour shift if you had to describe a 12-hour shift as a concert, what's the headliner?
I feel like it would be, um, who's the guy who died?
Which one? Don't tell me the one that did drugs.
Yeah, Ozzy Osbourne. I feel like it's okay. First of all, set the stage. I am a '80s disco skating rink baby child. So his band was Black Sabbath, right?
Okay.
Right?
Okay. Walk me through this.
I don't know
12-hour
any of
shift.
their titles of their songs, but I feel like it would be that level.
Okay,
How wait a I can't say the word.
yeah. Okay.
All right, so we've turned the volume up. We've turned the volume up on the problem. We've talked about some strategies that we're going to
Oh, I
turn it
like
down.
that. It took me a minute. I was like, what? No, we need to turn the volume
Okay,
down,
so
but I see what you're saying.
we talked
This is
about
our PSA.
yes. Turn it like there's a song that goes with that.
PSA?
No, turn it up. Turn up the volume. Help me.
Turn the beat
Oh,
around. Da,
got
da,
to
da,
feel
da,
the
da,
music.
da.
Oh my god, see that's my song now.
No one's gonna listen to us after this.
I know. I feel like I cannot wait to do our walking pad
Yeah,
to
it's
the
coming.
music.
It's
Okay,
coming.
so mindfulness, earplugs, noise canceling. How do you handle that one person who doesn't if you do have that?
Huh?
Like if there's one person that you said, "Okay, we're having quiet hours
Oh, and
from
they don't listen.
mhm. They walk
That's
down the halls
stern
screaming.
talking to a point where security might get involved.
Oh my gosh.
Yeah.
Alright, so noise is just not a noise.
Yeah, it's
It's
not
just
just
annoying.
annoying. There's proven science that this is a problem. We need to all work together to resolve it. So let's all work together as nurses to help solve this problem.
Lot of
Mhm.
resources available through the SCNA, that you can reach out to, and they're there to help. Like guidelines, noise guidelines, how to be a healthy nurse, it is all over
I
there.
love it.
You just gotta get in there and look at it.
So thank you for joining us today. As always, follow us on Instagram and listen to us on Spotify, Apple Podcasts, and YouTube. And as always, thanks
Thanks
for
for
scrubbing
scrubbing
in.
in.